This talk is really about other people, so I'm going to be very brief and I will step off. We will be talking today about JupyterHealth, and this is a project brought together by a big team. Some of us are here just speaking on behalf of the team, but you may be wondering, why are these two words in the same sentence, right? Jupyter and healthcare. And yes, indeed, we are talking about the world of healthcare, and this may sound like a crazy idea, and it is kind of a crazy idea, but in 2023, Ida Sim, who will be coming up next, came to me. I was introduced to Ida by the dean of our College of Computing, Data Science and Society, and Jennifer Chase said, there's a faculty member at UCSF who has an idea, and she wants to talk to you. And Ida showed up with a one-page PDF. It's fine that you can't read much in there. You'll see a better version of that diagram later when it actually makes sense. This is a document of historical value that convinced me that this might actually be worth doing, as crazy as it was, because she showed up with a complete architectural diagram that made sense. The questions she kind of brought to the table were, could we bring both the ethos and the technology of the world of Jupyter that you've seen in this community that this world represents, could we bring that to the world of clinical practice? And why would one want to do that? And the reason was, could that perhaps help drive some of the change that we have seen happen over the last 2 decades with these tools in research and education? Jupyter and the entire scientific Python ecosystem we've all seen has actually dramatically changed how research and education are done. Could something like that help in the world of clinical care? Obviously, I normally wouldn't touch the world of clinical care with a 10 or 100 or 1,000 foot pole because it's frightening, it's complex, it's regulated, it's messy. Every conceivable problem would make me want to run away from that. But Ida had a very clear idea, and she had the right expertise. She is herself a clinician. She's also an informatician, formerly the head of UCSF informatics research. She's also the chair of the IEEE working group on open standards for mobile healthcare data. So she knows both the clinical side and the technology side. She also had the right team. The Commons project, you'll hear from JP next, people who have worked in open source and open ideas in healthcare for a long time. She has a clinic where she sees patients. She has access to a team of UCSF clinical faculty who are interested in these questions. And she has access to the UCSF healthcare system and connections with industry, because I understand you don't run healthcare out of a GitHub repository, right? A hospital is not a collection of GitHub repos. It's a slightly more complicated entity than that, not one that I'm familiar with. But Ida and her team really had kind of all the right connections to make this possible. So we embarked on a mission to try to get funding. We secured some funding. And today, JupyterHealth is officially a sub-project hosted by the JupyterHub team, because a lot of what is being done is really kind of starts from JupyterHub. You're going to hear the rest of the story from the rest of the team. So I will step out now.
Thank you, Fernando. It was an amazing hour that we just sat there, and at the end of it, we had funding. I've never had anything quite so expeditious and funny, but I think you'll see why there's so much to be excited about JupyterHealth. So yes, I'm a clinician, so you've probably heard of the term precision health. This is my operational definition of precision health. What if each of us in this room, could get the best proactive care and also self-care that we need based on our complete data knowledge for our specific mix of conditions at a certain point in time within the context of our lives, both our clinical lives and our life situation. You will notice that this operational definition does not have the word AI in it. It does not have the word omics in it, because it's not about that. Those are just tools. It's about how we live. And if we really want to move the needle on health, I will have to tell you that in the US, 6 of 10 adults have one of these 7 chronic diseases, and 4 in 10, 40% of Americans have 2 or more of these chronic conditions. I don't think it's quite so bad in other countries, but just keep that number in mind. 90% of our $5 trillion in annual US healthcare costs are from these 7 chronic conditions. So if you want to move the needle on it, you have to be thinking about chronic diseases. And of course, we don't want to wait till people get sick. We want to treat them earlier. But I want you to understand the ecology of healthcare from really a seminal article in the New England Journal from 2001, and an analysis that had been redone from the 1960s. And surprisingly, the numbers were still the same. I think they're very different now, which is that out of 1,000 people in the US in the course of a month, only about 20% touch the healthcare system. 217 see a physician's office, 21 visit a hospital outpatient clinic, 8 are hospitalized, and fewer than 1 are hospitalized in an academic medical center like UC San Diego or UCSF. And yet we spend most of our time, and Fernando has taken his little pointer, I think. We spend most of our time, right, in AI and CS, we're talking about healthcare systems, talking about EHRs. And yet, chronic disease happens outside of healthcare, by definition, 24/7 outside. So what is the opportunity out there? Huge opportunity. Now with sensors and things, you guys are well aware of that, of course. BP cuffs, glucometers, Oura. I actually have a Dexcom G7 here. It's a continuous glucose monitor, patient-reported outcomes. So where we are today is we have lots and lots of these solutions. There are just 1,000 flowers blooming. We have a horrible case of allergies. And yet what we really want is the right flowers together that are put together pleasingly into a bouquet, right? That's what we would want. But not just any bouquet or one single bouquet, but each one of us should have individualized bouquets. The flowers that work for you, the apps that work for you, the sensors that work for you. Is it sleep, depression, and anxiety for someone? For someone else, it's going to be glucose monitoring plus, whatever, okay? And that's going to mix and match over time because we get better, we get sick, we acquire another one of those dastardly chronic conditions. So what we need is an ecosystem of modular, standards-based, composable solutions. Nothing new to you in this room. I will tell you that the healthcare industry does not think this way, right? We think client server silos, proprietary, the biggest, steepest, thickest walls you can imagine because patient privacy, right? But yet there is a different way. And so that was, I've been searching, JP and I, you'll hear from JP soon, searching for a way to bring the ethos of something like a Jupyter community. So the problem, of course, silos, inefficient workflows. I mean, I could go on, but the opportunity, really it's a pivotal moment because we have sensors, we have real-time data that's very personal, and we need this unified platform to bridge the clinical data, the self-monitoring data, and all the data analytic power that we have now. We have an amazing JupyterHealth team. As Fernando says, many are here. Developers, researchers, and clinicians. I cannot emphasize how important it is to have the people who really understand the problems. Got to solve the right problems. It's a fantastic, fantastic team. So we are building this open source modular platform, 1,000 flowers blooming. We see JupyterHealth is really enabling the florist at scale, if you want to push the metaphor maybe a little further than it deserves. But it's really the bottom layer here. It's the horizontal that JP will talk about next. But on that horizontal, we're building vertical applications that provide the targeted solutions for the specific use cases, either clinically in UCSF Health, UCSF, and also Duke have separate projects on diabetes. Columbia is working patient-facing, while canal, climate, and heart failure. You'll see some of this later from JP. And then we have one company already building on the JupyterHealth stack. And without further ado, I'm going to hand over to JP to talk through the horizontal. Go.
Thank you. Okay, so thank you both for the introduction to what we'll get into the slightly more technical portion of this talk. We'll try and make things a little bit more tangible. We'll go into, maybe as much detail as we can in the 10 minutes that remain. So JupyterHealth, right on this slide, you've got some of the buzzwords that mean things to you, right? It's an open source, it's a modular platform. We think about this as, at the moment, a tool specifically for doing the kinds of things that maybe healthcare providers or researchers in the healthcare space can do sometimes with big, huge proprietary systems. Some of them can't do it at all. And we're just trying to sort of lower the barrier to entry for these folks. So if you're trying to do work maybe at the intersection of patient-generated health data, things that come from wearables, from Internet of Things devices, from mobile applications, at the intersection of data with the electronic health record, so your actual clinical and medical information, and potentially big data sets, some of the sort of StarOmics related data sets that Ida mentioned. If you're trying to work in that confluence, that's sort of the purpose of what we're trying to accomplish. And that means that we need to do things that benefit clinicians, right? And clinicians can benefit from things that improve their workflows. They can benefit from things that give them better patient insights. We want to benefit researchers, which is largely around the sort of assortment and standardization and preparation of data for the work that they do. And for patients, which is giving them either the tools or giving their clinicians the tools to give them that precision medical care that Ida has described. So this is a big platform. Again, can't discuss all of this platform in the time that we have, but we want to touch some of the highlights. So you can see that the sort of crux of this is something called the Exchange. This is JupyterHealth Exchange. This is an attempt to take all of the various kinds of data that come from the ecosystem. So from wearable devices, from mobile devices, there's apps like CommonHealth and Apple Health for your health records and wearables that connect through those devices. Stanford has developed a platform called Spezi, which makes it quite easy to develop mobile applications that can feed data into platforms like this, and receive all of those data, and then do all of the things that are important for the healthcare industry, right? We standardize them. We make them fit within the context of both the institutional interoperability as well as access control, security, and data privacy frameworks, right? So you can't just sort of give somebody a CSV with all of these files and have them sort of have it on their laptop and then moved around G drives, right? Like this stuff needs to be controlled, and it needs to be controlled within the context of the healthcare system. Then next to that, we have a JupyterHub. It's a slightly customized hub that I'll talk about in a moment that just provides the connectivity and the access to control to those data. And then on the right side of things, this is really sort of DevOps land. This is how you move the work that you've done in collecting those data, in standardizing them, in creating visualizations, and actually putting them to work, right? So this is how we interface with things like the electronic health record. This is how we provide consumer health applications with the data and visualizations that they need, again, to provide those precision medical recommendations to patients. So today I'm just going to talk about 4 of the kind of key components here and walk through them a little bit. I have a bunch of demos. I will show one of them because it's extremely cool and I think you'll like it. And the others, just trust that they're there. And when you want to go back and look at our slides or come and find any of us, we'd be happy to show you ones that pique your interest. So these 4 key areas. The first is data acquisition, right? We're focusing for the most part these days on wearable devices, mobile applications. There's data management. Again, this is, it has to be a little bit more robust than just a database. It has to be a little bit more robust than just a CSV file. So, what are we doing in that space? Data analysis. This is that specialized JupyterHub and tools that I've described. And then last, EHR integration. So on the data acquisition front, our focus so far has been, as I mentioned, on patient-generated data. We're trying to take an approach that sort of marries some out-of-the-box support, right? So we have a couple of applications that you can just use to go start collecting data if you want to use like blood pressure, CGM data, or maybe Oura ring data. But then there's tools that make it easy for you to integrate into the system so that you can bring your own data if you have a different particular set of wearables or devices or data sets that you want to use. Consent and management, this one is really important as, again, it helps us fit within that context of a healthcare system or an academic medical center where this research and work is often happening. And then open and modular, right? We want to make sure that the tools that we build can be reproducible. So the first example that I'll talk about briefly is just one that we provide with the CommonHealth application. The CommonHealth app runs on Android devices. It's much like Apple Health. And Google has a platform called Health Connect that brings data in from a wide variety of wearable devices. Through the CommonHealth app, we can import those data into the JupyterHealth ecosystem, consenting patients along the way to make sure that they're only sharing the particular kinds of data that they want. Once we get those data into the JupyterHealth ecosystem, we can build complicated and wonderful visualizations based simply on Jupyter notebooks, right? This is just a particular type of blood glucose readout called an AGP report and dashboard that was built using notebooks, the same sets of tools that everyone else here is using, This is specific for CGM data in the healthcare domain now. The next example, I won't go into quite as much detail, but using this Spezi application that I described from Stanford, we have some students at Cornell Tech that are collecting location data over time and marrying that with climate data for temperatures that people are exposed to, the amount of time that they're spent out of the house, and then Oura ring data as well, and matching that to the clinical record with the hopes of being able to understand how extreme heat events have impacts on people's well-being and health over time. Okay, the next key component to dive into is data management. So this is, as I mentioned on the sort of platform overview slide, where a lot of the work that we've done has been. So our approach here is really centered around this one artifact called the JupyterHealth Exchange. It provides a data model that we can use based on HL7 FHIR and data standards such as the mHealth format, which is an IEEE standard for wearables and other kinds of external data, external to the health system data. Provides tools for administration so that you can work with it either through a UX or through APIs. And those APIs are both for write and for read, which offer flexibility in how the system can be used. The data model, won't bore you with this, but this is effectively how HL7 FHIR thinks about organizations and studies and patients and the data that are collected about them. Trust me, it matters that we do it this way. Administration. So the administration for this system is twofold. So we have a UX that you'll see briefly in the demo that I show in a minute that lets you navigate through the creation and management of organizations, of the different studies that you have, so that if a sort of research coordinator in a lab wants to administer this, you can deploy it and they can go about doing it. We also, of course, provide the API hooks so that you can make all of this stuff work. The write API will show you it being directly used by a blood pressure app in 1 second, provides the ability to connect up any mobile application or any web-based application, anything out there really that's generating these kinds of patient data that you want to bring into your system. And of course, the read API, if you don't want to rely on our own admin, or you have other purposes, or want to bring the data into visualizations in your EHR, for example, that's where that lives. Okay, so the example I'm going to show you, this is a company that we're working with called CareX, has produced a tool that does camera-based blood pressure monitoring. So here what you're seeing is a person who's managing a list of patients and studies, configuring a study to generate an invitation link, right, that will get sent out to someone who's using this CareX application, which will invite them to participate in this study. We'll invite them to share their data back to our secure repository. So now we're on the right side of this. The application is running. They've pasted in that invitation link, and they're ready to go. You may recognize Maryam, who was kind enough to volunteer to guinea pig and have her blood pressure recorded. This is not live, otherwise it might be a little higher, maybe not, I don't know. But so as you can see, the application is working its magic here. This is in fact the future. Imagine you're in a telemedicine visit, zoomed in with your doctor, and your blood pressure is getting recorded without a cuff that is unreliable and you don't know how to use at home. So this is really very, very cool stuff for whether you're a signal processing nerd or a healthcare nerd. This is awesome. So now Maryam's blood pressure data have been collected. She's all good to go. And you can see the app in the application, the type of stuff that she has. So we'll move forward, and here we now see those applications in just a slightly larger view back in the study manager. So here, oops, go back. So you can see particularly the data that she submitted has now been transformed into the mHealth format, which is just a JSON-based standardized format for all of the different kinds of data, as I mentioned, that come in external from the EHR. Okay, quickly, the last couple of components here, data analysis. This is probably the one that I need to spend the least amount of time because this is literally just all the stuff you know, but now you have access to these data in a secure and access-controlled fashion, particularly these longitudinal data from outside of the EHR. I will skip over this so that there's time for questions. Okay, and then the last is EHR integration. I just want to give a quick nod to this. This may not be something that's that exciting for many of you here, but after you've done the work of doing these analyses, you often then the purpose of them is often to get them in front of a care provider, right? If you think back to that blood glucose example, right, you've built this wonderful display that's really useful for a provider who's seeing a patient in their office, and you need to get it in front of them. Now, EHRs, if you know anything about them, are these just big, massive, monolithic operations. They're very difficult to connect with and work with, but they are federally required to operate as certain kinds of standards-based APIs. And we can leverage those standards-based APIs to basically generate dashboards and publish them to the EHR, right? So if you think back to my platform diagram a long time ago, all the stuff that's now living in your Exchange has been developed into visualizations using your Jupyter notebooks. You publish that notebook into a view, and that view now lives in such a way that the EHR can find the context from the patient that's with it, and the data from the Exchange for the wearables and other kinds of data, and put them together into that particular report that you saw. I'm going to let this run, but really I'm done. This is just showing how you would log into a synthetic EHR. This is one called MedPlum, but you can pretend that it's real. Find your patient, and once you've found the patient in here, it's essentially going to call up that blood glucose dashboard from before and render all of the data. So beyond that, why are we here? Why do we think this is different? This is probably not really news to anyone in this audience, but this slide, trust me, is a little bit more shocking, as Ida mentioned, to folks who live in organizations that don't operate in open, transparent, and GitHub-related ways. But interoperability across ecosystems, right? Open source and customizable, things that the healthcare industry struggles with, right? How do we build something and then share it with our friends? How do our friends build something and we build on that? And how do we all conduct science together in a way to move this stuff forward? We're really hoping that JupyterHealth can be a backbone that drives innovation across all of these different organizations and breaking down silos that, previously have been somewhat difficult to get past. So thank you. I don't know how questions work, but you can certainly ask them of any of us.